The moment you realize your cat is walking away from the food bowl, something inside you sinks. First, you tell yourself it's nothing, maybe they're being picky, maybe they ate earlier. But when hours turn into a full day and the bowl remains untouched, worry starts to creep in. Cats are known for their routines, and eating is one of the strongest signs that everything is okay. When that routine breaks, it often means something deeper is going on. Anorexia in cats is not just about refusing food. It is a silent signal that your cat may be struggling, physically or emotionally, and needs your attention more than ever. Anorexia in cats simply means a loss of appetite, but behind this simple definition lies a wide range of possible causes. Unlike humans, cats rarely skip meals by choice. If a cat stops eating, it is usually because something is wrong. Sometimes the cause is obvious, like dental pain that makes chewing uncomfortable. A broken tooth, gum disease, or mouth ulcers can turn every bite into a painful experience, causing the cat to avoid food altogether. Other times, the cause hides deeper inside the body. Infections, kidney disease, liver problems, digestive disorders, or even cancer can all reduce a cat's desire to eat. The body, overwhelmed by illness, quietly shuts down hunger as it tries to cope. Emotional and environmental factors can be just as powerful as physical illness. Cats are sensitive creatures, even if they act independent. A move to a new home, the arrival of a new pet, loud noises, changes in routine, or the loss of a companion can trigger stress and anxiety. That emotional stress can show up as anorexia. A cat may sit near the food bowl, sniff the food, and then walk away as if torn between hunger and fear. In these moments, the problem is not the food itself but the emotional state of the cat, which feels unsafe or unsettled. The symptoms of anorexia in cats go beyond an empty food bowl. You may notice your cat becoming less active, sleeping more than usual, or hiding in quiet corners of the house. Their coat may lose its shine, appearing dull or unkempt because they no longer have the energy to groom themselves properly. Weight loss can happen quickly, sometimes in just a few days, especially in smaller or older cats. Some cats may show nausea, drooling, or vomiting, while others may simply seem distant, no longer greeting you or responding to affection the way they used to. These subtle changes often carry a heavy emotional weight, because you can sense that your cat is not feeling like themselves. One of the most dangerous aspects of anorexia in cats is how quickly it can lead to serious complications. Cats have a unique metabolism, and when they stop eating, their bodies begin breaking down fat for energy. This process can overwhelm the liver and lead to a life-threatening condition known as hepatic lipidosis or fatty liver disease. What makes this especially frightening is that it can develop in a very short time, sometimes within just a few days of not eating. This is why anorexia in cats should never be ignored or treated as a minor issue. Time matters, and early action can make the difference between recovery and severe illness. Treatment for anorexia in cats always starts with understanding the root cause. There is no one-size-fits-all solution, because anorexia is a symptom, not a disease itself. If dental pain is the issue, treating the teeth and gums can bring appetite back almost immediately. If an infection is present, antibiotics or other medications may be needed to help the body heal. Chronic conditions like kidney or liver disease require long-term management, often involving special diets, medications, and regular veterinary checkups. In cases where stress or anxiety is the trigger, creating a calm, predictable environment can be just as important as medical treatment. Sometimes, encouraging a cat to eat requires patience and creativity. Warming the food slightly can enhance its smell, making it more appealing. Offering soft or wet food can help cats who struggle with chewing or swallowing. Hand-feeding small amounts or sitting quietly nearby can provide reassurance, especially for cats who are emotionally distressed. In more severe cases, appetite stimulants may be prescribed to gently remind the cat's body how to feel hungry again. When a cat is dangerously weak or at risk of complications, assisted feeding through a feeding tube may be necessary. While this can sound scary, it is often a life-saving step that gives the body the nutrition it needs to recover. The emotional side of treating anorexia in cats is often overlooked, but it matters deeply. Cats thrive on feeling safe, loved, and understood. Speaking softly, maintaining routines, and respecting their need for space can help reduce stress and rebuild trust. Your presence alone can be powerful. Sitting with your cat during mealtimes, even if they don't eat much at first, sends a message that they are not alone. That quiet companionship can slowly coax them back toward normal behavior. Recovery from anorexia in cats is rarely instant. Appetite often returns gradually, with small improvements that can feel like huge victories. The first few bites after days of not eating can bring relief and hope, reminding you that healing is possible. It is important to monitor your cat closely during this time, watching for changes in eating habits, weight, and overall behavior. Consistent follow-up with a veterinarian ensures that any setbacks are addressed quickly and that the treatment plan continues to support your cat's needs. Preventing anorexia in cats is not always possible, but awareness plays a major role. Paying attention to your cat's normal eating patterns helps you notice changes early. Regular veterinary visits can catch health issues before they become severe enough to affect appetite. Keeping your cat's environment stable, enriched, and stress-free supports both emotional and physical well-being. Even small acts, like keeping feeding areas quiet and clean, can make a difference in how comfortable your cat feels about eating. At its core, anorexia in cats is a call for help. It is your cat's way of saying that something is wrong, even if they cannot explain it with words. Responding with care, patience, and timely action can protect their health and strengthen the bond you share. When you take that empty bowl seriously, when you listen to the silence where eating should be, you are giving your cat the chance to heal. And in doing so, you remind them that they are loved, safe, and never alone in their struggle.